During the COVID-19 pandemic, many medical appointments have been canceled or delayed due to stay-at-home orders and less availability in medical offices. I have chosen to focus on the topic of delaying mammogram appointments during the pandemic and the risk it poses to women aged 40 and above. It can be especially troubling for women to miss mammograms because many breast cancers do not present symptoms such as masses, pain, or skin changes, which is why following breast cancer screening recommendations is so important. The earlier that breast cancer can be detected and treated, the more likely that treatments will be effective. According to the Journal of the National Cancer Institute, mammograms dropped as much as 80% during certain time periods in the pandemic, and as a result, experts have estimated 2,487 additional deaths from breast cancer by 2030. My target audience for this assignment is all women aged 40 and above who are at risk for breast cancer and have missed their annual mammogram in the COVID-19 pandemic. According to the National Comprehensive Cancer Network, breast cancer screening recommendations for women at risk includes mammograms every year beginning at age 40 for as long as a woman is in good health. My health topic includes delaying mammograms during the COVID-19 pandemic and the consequences that can result from doing so. It also involves creating ease of rescheduling for women in low-income areas who suffer from constraints of the healthcare system and the social determinants of health. In order to reschedule patients who may have missed mammogram appointments and to ensure others are on track for recommended screenings, I would impose a plan to increase awareness about breast cancer screenings and provide convenient ways to make appointments for them throughout the community. This would involve teaming up with mass vaccination sites and clinics to also host sign-ups for mammograms that will allow women to reschedule their appointments while also receiving their vaccinations. This would allow women comfort in knowing there are safety procedures in place at the vaccination sites, such as social distancing, masks, hand sanitizer, and trained staff to allow them to safely reschedule and confirm appointments. Having sign-ups at vaccination centers and clinics will also remind women of the importance of rescheduling their mammograms, provide convenience, and bring awareness to breast cancer screenings in general. Many other areas of the United States also saw a significant decrease in breast cancer screenings of older and low-income women during the COVID-19 pandemic. According to a journal in preventive medicine, breast cancer screenings for American Indian, Alaskan Native women dropped by 98% during the pandemic. And also, according to the Prevention National Breast and Cervical Cancer Early Detection Program, which screens low-income and uninsured women, breast cancer screenings decreased by 87% in April 2020. So another option for women living in low-income areas who may not have access to healthcare clinics would be to organize mobile screenings. By using mobile screenings, women would not have to travel far in their communities to get screened for breast cancer. These could include clinical breast examinations, or CBEs, which are conducted by healthcare professionals and are recommended for every woman annually after the age of 20. In addition, these mobile screenings would offer culturally appropriate education, so there would not be issues with health literacy or language barriers when conducting the screenings, and there would also be an option to help patients schedule their mammograms. Creating the addition of mobile screenings would allow women in low-income areas to avoid the cost and time of traveling to a clinic and would not have to take off as much work to do so. This would be especially helpful during the current COVID-19 pandemic, as many women do not feel comfortable in healthcare settings yet. The objective of this social marketing campaign is to help all women aged 40 and above stay on track with their annual mammograms and reschedule any missed appointments that occurred throughout the COVID-19 pandemic. This involves addressing those women who live in low-income areas and may not have equal access to care or transportation to appointments. The benefits of taking this action include following the recommended screening timeline for women aged 40 and above, and getting mammograms annually so that any cancer can be detected early and treatment will be more effective. By creating mobile screening options that are equipped with culturally appropriate education, we can avoid language barriers and bring the screenings to these areas that need it the most. This will also help to address provider linguistic and cultural competency that may occur at larger clinics and hospitals. I believe that providing additional services for women to schedule mammogram appointments and utilizing mobile screenings will help to improve individual health behaviors. Given the decrease in breast cancer screenings, during the COVID-19 pandemic, it is imperative to keep cancer screening and prevention at the forefront of communities' minds, and especially for women aged 40 and above who are at risk for breast cancer. If a community can make efforts to increase awareness and stress the importance of breast cancer screenings, it is more likely that women will take it more seriously themselves. Also, longer delays in getting screened are more likely to lead to a later stage breast cancer diagnosis that requires more intense treatment. Utilizing mobile screenings for low-income communities and rural areas can also help address some of the healthcare system issues and the social determinants of health. By addressing issues such as access to care, cost, transportation, and cultural and language barriers, we can help get more women screened for breast cancer and decrease the number of women who have to go through later stage diagnosis. Furthermore, by assisting women in rescheduling mammograms and getting on track with recommended screenings, we can help to improve the well-being and prolong the lifespans of women across the community. Here I have my 4 Ps. Product would include the mammogram appointments and the scheduling and rescheduling of missed appointments during the pandemic. Price would include the time and cost to travel to the clinic, taking time off of work to do so, and childcare costs. Place would include teaming up with vaccination sites and clinics and holding mobile screenings in low-income areas to provide options for rescheduling and scheduling their mammogram appointments. And promotion would include bringing awareness to the community through flyers, social media, and news stories. Here I have my 4 Cs. The customer would include all women aged 40 and above who are at risk for breast cancer and have missed mammogram appointments during the COVID-19 pandemic. The cost would be free to schedule. Convenience would be holding sign-ups at vaccination clinics and mobile screenings that would bring convenience to all women who live in different areas around the community. Communication would involve bringing awareness through social media, flyers, and news stories. Thank you very much.